Hello, you're welcome to this video. In today's video, you're going to be talking about diabetes, its complication, and how someone becomes diabetic. And as well, I'm going to give you some hints on tips on how someone can prevent diabetes and even to reverse it if you are already diabetic. If you're meeting me for the first time, if you're stumbling on my video for the first time, my name is Dr. Robert Fulfak. I'm a medical doctor and a lifestyle physician. On this channel and on all my platforms, I share with you habits and health tips, lifestyle you would like to adopt to have an excellent health and an overall well-being. So I welcome you to this video. If that resonates with you, I encourage you to subscribe and activate the notification button so that you will not miss any video I'm going to be sharing on this platform. So let's go on to this video. As I said, I'm going to be talking to you today about diabetes. Diabetes. Now, talking about diabetes, what you need to understand is that diabetes is a metabolic disease characterized by the increased level of your glucose in your blood, which is known as glycemia. When you have an increased glucose in your blood consistently, and that does not go back down as it's supposed to, is your tag as being diabetic, and that can lead to many complications from eye complications. Talking about diabetes retinopathy, where it can lead to blindness. Talking about kidneys complication of diabetic nephropathy, which can lead to chronic kidney disease and even kidney failure, and even a level of your blood vessels. Diabetes have countless complications in many different systems of your body, and this is mainly due to what we call hyperglycemia. This is a concept that goes hand in glove with diabetes. And the another thing I would like you to understand is that we have different kind of diabetes. We have what we call type 1 diabetes, we have type 2 diabetes, and we have what it's also known as gestational diabetes. Now, for what these three kind of diabetes are concerned, what you're supposed to know, what you have to know is that this diabetes is an autoimmune disease. Autoimmune disease simply means that you have the cells of your body that are attacking the cells of your pancreas, leading to the destruction of the cells that are supposed to secrete an hormone known as insulin. I'm going to be talking to you about insulin deeply, which is it's a vital hormone in the pathophysiology of diabetes. But in this type 1 diabetes, usually the patients are born with the disease. So this represents less than 2% of all diabetes. Less than 2% of all diabetes. So they are less than 2%. And we have type 2 diabetes. This is the group of diabetes that we're going to be talking about today, or that we're going to be emphasizing on today. This group of diabetes are known as the insulin-resistant diabetes. So this group of patients, they are born normally, they are okay, but when they arrive at an age, because of the multi exposure they wear to the risk factors and even their lifestyle, they tend to develop this type of diabetes, which is known as type 2 diabetes, and this represents 95 to 99% of all the diabetes we have around the world. And then we have gestational diabetes. This kind of diabetes is for pregnant women. We have a group of women that whenever they are pregnant, also because of their lifestyle during the pregnancy, they can develop gestational diabetes, and this represents only less than 2% as well of all the diabetes. So these are the main group of diabetes we have. And for today, in this our case study, we're going to be focusing on type 2 diabetes. Type 2 diabetes, the insulin-resistant diabetes, and how does that occur? How can someone develop this type 2 diabetes? First, I may mention the fact that in diabetes, the main pathophysiology, or what will lead to the different signs and symptoms of diabetes that we have around this disease, is hyperglycemia. And now, how do we arrive to this hyperglycemia? Consistent having a high rise blood sugar in your blood. Or how do we arrive here to have the glucose constantly increase in your blood? How do we arrive here? So we're going to begin with the risk factors. The risk factors that can lead to this hyperglycemia, or that can lead to type 2 diabetes. We have mainly two groups of risk factors, which are what makes you at risk of developing type 2 diabetes. And these groups are, I segment them into lifestyle and genetics or non-modifiable. So I have my two groups of risk factors. Within the lifestyle, what do we have? Chronic sugar consumption, sedentary lifestyle, stress, chronic stress, obesity, and for the we have many other lifestyle related risk factors, but I'm going to stop here for now. For the genetic or non-modifiable risk factor, we have the age, usually more than 40. We have the family history. That is, if you have a family member that was diabetic, you're also turn and prone or more likely to develop type 2 diabetes. This is due to a gene, because there's a gene that once you have it, you are tend to express it, and even you are tend to express it and make you more likely to develop type 2 diabetes in the future. And what I want you to understand is that even with having this gene, there will still be a risk factor, or there will still be, even given the fact that you have a gene, or even those that are having a gene, there's still a risk factor that they have been exposed to chronically that will lead to the expression of that gene and makes it develop type 2 diabetes. So it means that not everyone that have the gene or that have the family history of diabetes are prone to develop type 2 diabetes. As a matter of fact, knowing that you have a family history of type 2 diabetes is more a call for you to be very vigilant and watchful at the level of your lifestyle, not to develop type 2 diabetes. So now let's go on into the etiology. How can someone become type 2 diabetic? We have the risk factors. Now, how does that occur in your blood? And for you to understand, I'm going to introduce the etiology. For you to understand the etiology, I'm going to introduce you to the main hormone that is responsible, or that is imbalance in your blood stream will lead to the hyperglycemia, and this hormone is known as insulin. Everything is linked to insulin. Talking about type 2 diabetes, everything is linked to insulin. How will your chronic consumption of sugar will affect your insulin level in your blood? Your stress will affect your insulin level in your blood. Sedentary lifestyle will affect your insulin level in your blood. Obesity will affect your insulin level in your blood. So insulin is the middle ground. Insulin is like the junction for all of those. So talking about insulin is hyperinsulinemia that we need to insulin resistance. Now, whenever you consume sugar chronically, it may be from poor diets. Your feeding is made more of high carb diets and highly processed foods made up of added sugar. The spikes, in fact, the chronic and the high frequency of you consuming those food, we causes spikes of insulin in your blood, because whenever you eat, whenever you eat a food that has a very high glycemic index, it will lead to the free or the secretion of glucose in your blood that would then provoke or stimulate the release of this insulin. What is the role of insulin? Insulin role is to make sure the glucose that you eat from the food you've consumed will enter into the cell. Talking about the muscle cells, the brain cells, and all the cells of your organ, liver cells, and for them to be able to use, those cells need glucose for them to function normally. They need glucose as energy. So whenever you eat chronically this food high in sugar, it's going to lead to the secretion of insulin. So every time you consume those food, insulin keeps spiking. And that insulin that is high in your blood will keep on knocking at the door of the cells for them to open to receive the glucose. They'll keep on knocking the door of the cells for them to open to receive glucose. And once the insulin the ones that happen chronically for a long period of time, it will lead to a situation where those cells, because they have been overstimulated for long, they have received the signal from the insulin for long, they will become used to it, and later on they will no longer react, because your pancreas will be used to secreting the insulin excessively, and even when you don't have glucose in your blood, the insulin will still be high. So it means that insulin will keep knocking at the door of the cell, and once the cells will open, glucose won't enter, because not just the increase of the insulin in your blood is not just related to that glucose that normally enters. So it means that there's no glucose, but your insulin is high, and the cells receive the signals, but no glucose is coming in. They will receive it as a signal that, oh, it means this insulin is no longer giving the information that there's glucose. So within the long run, the insulin that your pancreas normally secrete will give a signal to the cells to open, but the cells won't open. So it will lead to a situation where we call insulin resistance. So simply put, that is insulin resistance explained to you, because there was an chronic increase of insulin in your blood, insulinemia, hyperinsulinemia. It will lead to insulin resistance because the cells are being overstimulated, and therefore they no longer respond. They're no longer opening themselves to receive glucose, and this insulin resistance will activate a vicious cycle that will provoke hyperglycemia. So it becomes a cycle. It becomes a vicious cycle where you have an insulin resistance and the glucose is increasing in your blood, and your pancreas will keep fighting. This is the beta cell of your pancreas. Your pancreas will keep fighting to secrete more insulin, and the more insulin you keep secreting, the hyperinsulinemia keep increasing, and it keeps worsening the insulin resistance. Why is your pancreas keep secreting more cells? Because you're receiving the feedback that there's not enough insulin. Why? Because the glucose in the blood keeps increasing. So it keeps secreting more insulin for your cells to be able to react to the insulin, the level of insulin. For your cells to be able to react to insulin, it demands a high concentration of insulin in your blood, which will keep worsening the hyperinsulinemia and by the same time worsening the insulin resistance. And this leads to hyperglycemia consistently. And then we start talking about type 2 diabetes. The hyperglycemia or the increased glucose in your blood will lead to all the complications you have all over the organs, the kidneys, the eyes, the heart, the blood vessels, and even the blood itself. Then it's the same pathophysiology that will happen with stress, chronic stress. And what you should know is that there are some hormones that are also known as stress hormone. We have insulin, glucagon, and cortisol. So this same insulin will keep being secreted in a high amount if you are stressed. Yes, whenever you are going through stress, maybe different kind of stress, maybe from your work, you may be stressed because of whatever, because of your health, anything that will make you to be stressed up will lead to an increase of insulin in your blood. And once that become chronic, it activates the same system of hyperinsulinemia, insulin resistance, then hyperglycemia. That's how stress can also lead to type 2 diabetes. The same thing with a sedentary lifestyle. You eat a lot of sugar, but you don't do a lot of activity to burn those sugar, leads to chronic insulinemia and chronic hyperinsulinemia and insulin resistance. Same thing with obesity. Obesity means you're in a state where you have overstored fat. So constantly you have energy in your bloodstream. Energy means the presence of insulin. Insulin means overstimulation of cells, insulin resistance, then hyperglycemia and type 2 diabetes. So that's the etiology. That's the vicious cycle that many people that are type 2 diabetic are actually suffering from. And taking medication, most medication that are manufactured to solve the problem of type 2 diabetes, they are not actually solving the problem at the etiology. They will work in those medication work in reducing the level of glucose in your blood by many mechanisms. Some by increasing the level of insulin. Some even go to the extent where they give some patients short of insulin. But that doesn't solve the problem. That may manage the symptoms for a while, but it doesn't solve the problem. That's the reason they keep taking the medication again and again and again. And they end up developing the complication that comes with type 2 diabetes. Why still be on medication? So the question you ask me is, what should someone do to end the cycle of type 2 diabetes? The answer lies in lifestyle medicine. Lifestyle medicine. So as doctors, we are trained to put patients on medications whenever they are diagnosed with type 2 diabetes, but we don't emphasize a lot. So this is a call as well to my colleagues. You don't emphasize a lot to the lifestyle approach. But in solving the problem at the root of type 2 diabetes, the answer is at the level of your lifestyle modification. Lifestyle modification is your diet, physical exercise, stress management, and even relationship management. There's a relationship around you, because the kind of relationship you have around you also have an impact on your stress level and also on your insulin level. So once you work on establishing a lifestyle that will help you to eat well, manage your stress, and avoid or move more. So eat well, manage your stress, move more, and love more. Those are the key point of lifestyle medicine. That's how you can break the cycle of hyperinsulinemia, and by the same way reverse your type 2 diabetes. So that's why I wanted to share with you on this video of today.